All right, good day. Welcome everybody to Exploring Specialties in Medicine. This is our third session featuring uh, gynecology, ophthalmology, wow, and hematopathology. Wow, just stumbling all over these words. But I'm sure the panelists will better be able to explain what these specialties are and answer all your questions. I'll encourage everybody to follow us on our LinkedIn page. This is where we post all of the new upcoming workshops, but importantly, where we also share scholarship opportunities, research opportunities, summer opportunities, and internships. Our YouTube channels where you can find all of our past workshops and where eventually this workshop will also be posted. Um, this is now our third year, so if you don't see a specialty this year that you're interested in, I'm sure you can find one from our past workshops. And all of these workshops, as I mentioned, are posted unless, of course, a specific physician asks us not to post their session. So if you go to the YouTube channel, you can search for the HBCU Mentoring Program on YouTube, and you'll find the channel, follow it, and you'll find this as well as all the other workshops that we host. As a reminder, tomorrow is our last session where we'll feature these four specialties that I'm not going to try to say. So you can register here or wherever you found the original poster. And our upcoming workshop would be for those who are also exploring beyond the MD. If you're thinking about careers that might not require medical school or a straight bench science PhD program, these are some of the careers that you can explore, and you'll have a chance to speak with the persons who are currently practicing these careers and learn about how they got there, what they like about their jobs and what they don't. And likewise with the other workshops, we have versions of this on YouTube as well. So we're going to jump right in. We got started with Dr. Khara Simpson, who I believe is sharing her screen.
Did I already start sharing? Oh my
No,
goodness.
would you like to share your screen, or would you like?
Oh, I can share it. Yeah,
Yes.
absolutely.
Okay. All right.
Okay, and hopefully everybody can hear me well. Good morning. Is it still morning? I guess it's afternoon now. So good afternoon, everybody. My name is Khara Simpson. I'm actually a board certified OBGYN, but I currently practice as a minimally invasive GYN surgeon. And so I'm going to talk a little bit more about that and what my journey to medicine has been. I'm an assistant professor of OBGYN. I also am the associate fellowship director for our fellowship program in this subspecialty. And then I also serve as the vice chair for patient safety and quality for the Department of Gynecology and Obstetrics, as well as the physician advisor. So hopefully that at least tells you all the different ways, right, that you can expand your career in medicine, both clinical and administrative. So I always like to start the talk just talking a little bit about kind of like my upbringing. So I come from a family that has spent quite a bit of time in the military. My dad was actually in the Navy. My grandfather was in the Air Force. My uncle was in the Marines. And so for that reason and others, I spent a lot of my life actually traveling throughout the country. So all the stars are all the different places that I've lived, not just as a child, but also during my training. So it's one of the things that I think is important about just training and having different experiences. So this is just a little bit more about that kind of adaptability, which is what kind of brought me into the concept of wanting to do some type of medicine. I actually trained at Hampton University, so our home by the sea. So I'm not sure if there's any other HBCU grads on, but very proud of that heritage. Actually, my uncles pretty much have also all been HBCU trained. My dad also went to Howard. So it's interesting. So I went to undergrad. I actually was a major in biology with a minor in chemistry. Was very sure at an early age that I was going to go into medicine. And then, I became a little bit of an adult and decided that, I wanted to experience the world. So what my next step was actually after I graduated was actually ended up getting a job for MCI WorldCom. And I actually worked in small business sales. And during that time period, I realized, oh, I definitely want to practice medicine. And that even though I enjoyed my job, I enjoyed just like actually contributing and having my own space and those types of things that I wasn't being fulfilled by my job. So just another opportunity to think about what it means to take all of your life experiences and let that allow it to kind of dictate to some instances what you do. So it was interesting. So it's in my mind, it made perfect sense that I would, even though I had been 3 years out of undergrad at that time, that I had taken the MCAT before. I was like, oh, it should be so easy for me to get back in. So I ended up retaking the MCAT to try to improve my score and apply. And I applied very locally because I was sure that I was going to get accepted, and unfortunately did not. And that was a really difficult time for sure. But then I just made some changes to what I did, and then ended up reapplying, and eventually got in. So not only was I proven to be adaptable, I was also proven to be somewhat resilient. So just want to emphasize there's a lot of intangibles, right, that can make you successful. So there are traditional pathways, there are non-traditional pathways, but all of them sometimes can lead to a similar place. So hopefully that offers some encouragement if anybody's on this journey and has, veered in different directions before coming back to this. So one of the people who I attribute greatly to my success was, so I, reapplied. So I got rejected the first year. And I think I actually took the MCAT another time. Then I went on an interview with this gentleman here, Dr. Ash, who's a really prolific researcher. And he said to me, he was like, oh, I think this is going to be great for you. I think it's been hard. I think it's going to be hard for you, but I think you could be successful here. And so I actually did like an academic reinforcement program at Howard University College of Medicine. And that was kind of the beginning of my story. So why OBGYN? I always knew I wanted to do maternal health care. I just love that I get to see women throughout the course of their lives in many different situations. And I appreciate the opportunity to support women in my career. So this is how I got to meet Dr. Belcher and be able to actually start some of my research during my medical school career, which is why one of the only reasons I'm actually here at Johns Hopkins now is because she was such a great mentor to me and was so amazing. And I wanted to continue that. So I did my residency here at Johns Hopkins. That's me so long ago. And then, so there's many pathways. So I want to talk a little bit about OBGYN because like I said, I'm a board certified OBGYN, but I do not practice obstetrics at all. And I think one of the cool things about OBGYN is all the different pathways that you can go. So if you look at the top, it says generalist. So a generalist is someone who practices both OBGYN. These are going to be providers that do the lion's share of work within the OBGYN community. You can be maternal fetal medicine. So maternal fetal medicine is going to be high risk OB. So patients that may have complex medical conditions, sometimes even if the baby has a complex medical condition. So you guys may have seen some offshoots in maternal fetal medicine, fetal therapy. There are actually surgeons that operate on babies when they're still inside mother's belly. So that's an outshooting or an out from maternal fetal medicine. GYN oncology, that's going to be cancers in women, typically of the pelvic organs, so of the uterus, ovaries, and vulva. We have urogynecology, so women, if there are any opportunities in terms of like pelvic organ prolapse, bladder incontinence, things like that, or sometimes even fecal incontinence. There's an entire subspecialty for that. Reproductive endocrinology, so doing work on helping women get pregnant, and a lot of really amazing research that goes into that. There's adolescent gynecology, so focusing your care on patients that may be in the single digits of ages to up to 21. There may be some unique opportunities and conditions that affect that population, so you could specialize in that. There's family planning, so focusing on contraceptive care. And then what I do, which is minimally invasive GYN. So what I did, so OBGYN is a 4-year residency. And then I actually did 3 additional years of fellowship training. So my first year, I did actually a dedicated year of research specifically regarding robotic skill acquisition. And then I did 2 years of a clinical fellowship. And so that fellowship is going to focus on whatever you can do that's minimally invasive, which can be laparoscopy, can be robotics, can be vaginal surgery. In general, our goal is to try to reduce the incision size as much as possible at all times. So it also includes hysteroscopy, which is actually using cameras that go in through the pelvis. So we know there's many benefits of using smaller incisions, right, in terms of patient outcomes. So yeah, this is my fellowship. And so we focused a little bit on certain conditions. So a lot of what I do is management of fibroids, whether that be medical, interventional, or surgical. Conditions like endometriosis, ovarian cyst, pelvic pain. And then I just particularly have a focus on robotic surgery, which is what I do, is the tool that I use for most of my surgery. So I did my fellowship actually, like I said, at Columbia. And one of the wonderful things I love, these are two of my mentors, surgical mentors in the picture to the left, is I've gotten to travel with what I do, which has been so cool. So I've traveled and practiced and supported positions in India and Saudi Arabia. And so there's work to be done here. There's obviously work to be done abroad. So then I did my fellowship and then I came back as faculty in 2016. And so, yeah, so we actually did not have a fellowship at that time, but we were able to actually start our fellowship program here. And right now I get the opportunity to mentor so many bright students. I talked a little bit about, yes, creating this program in Saudi Arabia for robotics. Right now I do a lot of work within the quality and safety realm in both obstetrics, but mostly also in GYN. And then just the opportunity to do a lot of community outreach. I love my job, but I always joke about loving to do my job also for free. So like there's things that I'm obligated to do within my job. And I love though the opportunity to talk to women and people about their bodies and make sure they're just informed and have a safe place to land. So I like to work with different organizations within the community and present and talk and be available, honestly, for questions and try to get people in with providers as needed. So my typical work week, I do, and this is probably changing a little bit as I do more administrative work. I usually do 1 day of clinic, which can be in person or can be video. We do a lot more video and telehealth now. And then I operate probably at least 2 days a week. Sometimes I'll do more just depending on what patient need is. And then usually now I probably have really 1 to 2 administrative days where I focus on a lot of my quality and safety work. And then obviously just making sure that all the other administrative things for my clinical duties are taken care of. And that's what I got. So thank you so much for taking some time to listen to me this morning. Well, this afternoon. I keep saying morning, but it's the afternoon.
Thank you so much, Dr. Simpson. It was a wonderful talk, and I'm excited now about GYN.
You see, it's amazing, right? I'm going to stop sharing my screen too. That's okay.
All right, so we're going to move right along to Dr. Alisha Ware, who's going to talk about her specialties in pathology.
Hi, everyone. I do not have slides. I was just going to talk to you all, but also feel free to stop me if you have any questions. So my name is Alisha Ware. I am originally from New Jersey, outside of Philadelphia.
Sorry, Alisha, I'm not sure if you're aware that your camera is off.
Oh, hold on. Sorry. Can you see me?
Yes.
Yeah. I just discovered that it like pops down and now I forget to take it back up again. Okay, so hello everyone again. So my name is Alisha Ware. I am originally from New Jersey, outside of Philadelphia. From there, I went actually to Howard University for my undergraduate training, where I majored in biology. I say I was boring, like I did bio major and chemistry minor, so nothing super exciting. And then from there, so I'll talk a little bit about like applying to med school and what I wish I had known at that time as well. But I sort of, I had always wanted to be a doctor, and I sort of imagined myself as doing more of like a community practice or like internal medicine type physician role. So as I was applying to medical school, I was a very shy undergraduate student, and I really didn't know how to utilize my mentors very well. So I sort of went in blind, so to speak, and did a lot of Googling along the way of like what to do, how to apply. And I applied to a few schools, I think about like 10 to 15 at the time. And I was accepted at 3, and I essentially went to the best one that I was accepted to, which ended up being UVA. So I went to UVA in Charlottesville, Virginia, the University of Virginia. All throughout my medical school, up until really like my 3rd year of medical school, I was still planning on going into internal medicine. I had already had my mentors lined up and was planning on doing infectious diseases, actually. And some of the things that I really loved about infectious disease were the sort of medical mystery that goes into it, the multidisciplinary teamwork. I enjoyed the patient interaction, actually. So as a pathologist now, I don't see patients, but that was something that I did enjoy throughout medical school. And then sort of as I was going through the wards, I was sort of like, okay, like I could do this, and it would be fine. But I sort of felt like something was maybe missing or didn't click entirely. And during my early on in my fourth year, I ended up doing a rotation through neuropathology, which is the area of pathology that looks at the brain tissue. And I really clicked with the faculty that I was working with. And I felt like sort of all of those missing pieces came together. So like the parts of internal med and infectious disease that I loved, and then maybe not so much of the things I wasn't too crazy about. But I also really felt like I found my people. And so it was sort of like a little bit later in the game to switch the specialty that I was interested in. But I did have time due to the structure of our medical school curriculum. I had a few more elective opportunities before having to apply for residency. So I was lucky in that regard. And I used essentially all of the time that I was allowed to spend time on pathology rotations. So pathology is a very broad field, and essentially any area that you can think of in medicine, there's a specialty in pathology for that area. So I really loved the broad aspects of pathology. I loved the interdisciplinary teamwork, the communication. I loved working with clinical teams and doing tumor boards, but also looking at slides under the microscope. So I ultimately decided that I did want to go into pathology as a career. I ended up applying mostly mid-Atlantic just because of where my family was and where I was comfortable. But I did want a larger city than what Charlottesville had to offer, and a city with a little bit more diversity of ethnicities, places of origin, etc. So I applied at Hopkins. I applied some other places in the region. And honestly, like I had a low expectation of coming to Hopkins. Like I did not think that Hopkins would want me, to be honest. And I sort of went in and was like, okay, like, worst case scenario, I love my people at UVA. And like, if I don't get to a larger city, I would be happy landing there as well. But I really loved Hopkins when when I interviewed here. I really felt like I clicked with the people. I felt like the practice philosophy was right in line with what I wanted to do. And there was lots of interdisciplinary connection and communication that I really valued and wanted to be part of my training. So I was very lucky to match here. And I ended up doing anatomic and clinical pathology training here, which is a 4-year program. So in pathology, we have a few different options for training. So most pathologists do APCP, or anatomic and clinical pathology training, where we focus on anatomic pathology, which are more surgical pathology subspecialties. So looking at tissue under the microscope of various organ systems, versus clinical pathology, which is our more lab-based aspects of pathology. So working in the clinical laboratories, evaluating blood samples, body fluid samples, et cetera, doing laboratory testing. So most of us do a combined program. You may also opt to do either anatomic or clinical pathology as a 3-year program each, with usually with a pretty large research component as well. And then there are also subspecialty programs like an anatomic and neuropathology program that's combined, and that is a 4-year program also, where you can do the surgical specialties of pathology as well as focus on the pathology of the brain and central nervous system. So those are various options. I opted for APCP. I was pretty open still and wasn't quite sure what I wanted to do in pathology. But throughout my training, I fell in love with hematopathology, which is a study of diseases of the blood, bone marrow, and lymph nodes. So mostly leukemias and lymphomas, diagnosing them under the microscope and using laboratory techniques such as flow cytometry. So that is what I do now. I did my fellowship here as well. Most of our pathology fellowships are 1 year, with some offering a second research year. So 5 years total of training after medical school. Um, and after I did my fellowship, I stayed on as faculty here for 2 years. Because of family reasons and my husband looking for a job as well, we ended up moving down to North Carolina, where I was at UNC for 2 years, and then recently came back. In full disclosure, we had one of our large pathology conferences here in Baltimore, and coming back and learning about some opportunities in the department sort of led me back to Hopkins, and I'm very grateful for that. So I've been here since the fall. Since I came back, I also have a role in the fellowship training program. So I'm the fellowship director for our hematopathology training program. So I do a lot of education and mentorship through that role. And I also have roles in well-being, and I serve as the deputy director for diversity, equity, and inclusion for our department as well. So a few different hats and different areas. If anyone is at Howard right now, we're going to the Howard Residency Fair on Saturday. So I hope to see you there as well. But I really value the outreach opportunities and the education opportunities that I've been able to take part in as a pathologist. I think we have a pretty good work-life balance as well in terms of our daily schedule. So most of our days are about like 8 to 5 or 9 to 5 when I'm on service, which means that I'm accepting new cases from patients that are getting biopsies in the hospital. Then I might stay till 6 o'clock usually, but I have to leave for daycares, and I'm able to do daycare pickup every day, which is good and very important to me. And then we're able to actually take call from home, so we can use our virtual networks to access any of the hospital resources that we might need when we're on call. But it's very rare that we would need to come in when we're on call. And typically for us, we take one weekend a month and about 1 week of evening call a month as well. Otherwise, yes, I'm able to explore my other education and scholarly interests and participate in various committees as well. So that sums up everything pretty much for me.
Thank you so much, Dr. Ware. We're going to move right along to Dr. Ruth Tessema.
Hello, I'm Dr. Tessema. I'm a current ophthalmologist at Wilmer Eye Institute at Johns Hopkins. My journey into medicine, also not a straight path. I'm originally from Ethiopia, born and raised there, and moved to the US when I was 21. So when I first moved here, I was interested in medicine. But a lot of my credits that were in Ethiopia were not transferable, so I had to start undergrad from scratch. So I was this 21-year-old with a whole bunch of 18-year-olds. And then the journey into medicine just felt like a forever path. There's 4 years of undergrad, 4 years of med school, and then 4 to 7 years of residency. And it felt like, when do I start my life? And, when do I have kids? So at that point, I started entertaining the idea of maybe I'll do PA school. And so I took about 2 years of prerequisite classes. I had mentors that I was talking to at the PA school at Howard. And after applying, I got a rejection letter. And I was very certain that I was going to make it. So I went in, talked to the program director, and the response I got was, when one door closes, another opens. And I didn't know what it meant at the time. And I also shortly after that found out that I was pregnant with my first daughter. So I took some time off. And at that point, it was a crossroads of whether I continue a journey in a family fashion business, or I double down and just go straight into medical school. So I decided to complete my undergrad studies at Howard in biology and applied to medical school. And like most, I also spent time studying for the MCAT. And at the time, my understanding was you had to be really good in physics and biochemistry and chemistry. And so a lot of my time was spent in just learning the content, and did not perform well on my first MCAT. So I had to retake it again. And the second time I understood that it's a test taking skill. And so I spent time understanding the test, did well, and I wanted to stay in the area. So I applied to all the schools within the DMV area, and I was accepted to Howard. I did undergrad in med school at Howard. So after first year of med school, some students a year before me had taken an international trip and were giving a presentation, and I found that interesting. So after first year of med school, I went on this mission trip. So you basically end up in this big hospital in Ethiopia, in a rural country, and you just spend the day exploring all these specialties. And I thought my career was going to end up somewhere in surgery or OBGYN. But I quickly realized that it wasn't my cup of tea after seeing a surgery that took 12 hours with a patient who had a prolapsed bladder and uterus. So I started going to the other departments and I stumbled upon ophthalmology. I was fascinated by how intricate the surgeries were and how life-changing. It's kind of a little bit of a cheat because there's that instant gratification of doing a cataract surgery and seeing a patient going from not seeing and then being able to see the next day. So I decided that that's what I wanted to do. And upon returning back to the US and talking to my mentors, I was met with a lot of, it's very difficult to get into, and you need great step one scores and, have a backup plan in case, you don't match into ophthalmology. And that motivated me to work even harder. I did not want to chance not being able to apply to a specialty that I'm interested to because I didn't put all my effort into doing well. So that kind of disciplined me all throughout second year. If I took a week off without studying, it felt like forever. And that motivated me. And then fortunately, I was able to match into ophthalmology. And so I went to UC Davis out in California to do my ophthalmology residency. After graduating, I loved the weather out in California, and so I decided to take a job there with Kaiser. But after 2 years, I realized, family was beat the weather, so we decided to move back to Maryland, and I took on this opportunity with Johns Hopkins. So as far as ophthalmology, even, that little eyeball has different parts to it. There's subspecialties within ophthalmology, cornea and retina and glaucoma and pediatric. These are additional fellowships that you do after your 3 years of residency. So the residency for ophthalmology is you do 1 year of internal medicine or surgery, and then you spend 3 years doing focused ophthalmology residency. After that, you do an additional 1 to 2 years of your fellowship of choice. I decided to do comprehensive ophthalmology, and that entails seeing patients with a wide range of pathologies. And then for those, advanced glaucoma patients or patients who have advanced retinal diseases, those get referred to the subspecialties. So looking back, I think the biggest thing I would say about my journey is, don't be afraid to explore and follow your passion. And sometimes you'll have to take a detour. And the best path is the one that you least expect. Take the journey and mentorship and networking along the way. I think mine is the shortest here.
Oh, perfect. It's perfect. All right. So I'm gonna stop the recording. Thank you to all of our speakers.